Welcome to the 5th Mayor's Emergency Response Roundtable. I am Rick West, and before we begin tonight, I want to offer a very special thanks to all the residents, the business owners, and the citizens of Chesapeake for the strong, positive, community-oriented ways in which we've come together to meet the challenges of COVID-19. We've got a long way to go still before this pandemic can be called under control, but with adaptability and focus and resilience that you've shown, I'm more confident than ever that Chesapeake will meet whatever obstacle this virus sends our way. I think in the presidential press conference yesterday, the vice president commended the American people for rising to the occasion and doing the things that we've been preaching for the last several weeks. And I know that's even probably more true in Chesapeake, as people I talk to are practicing those things that we've talked about week after week. And we just can't thank you enough. I think the results are going to be positive. We've been talking about a lot in the past roundtables about the way the city has been responding to particular things like how services and such are changing. And one area that we've not touched on, but is very critical and important in these times, is our human services and our behavior health programs. I'm joined today by Jill Baker. Jill is a Director of Human Services. And Joe, I always have the hard time. Sislovich. Joe Sislovich. I don't know why that just doesn't roll off my tongue. Joe has been for a number of years our Director of Chesapeake Integrated Behavioral Health Care. He does an outstanding job, and he is here as well as Jill Baker to discuss the vital services that they continue to provide. So let me start with you, Jill. We know that the virus has hit a lot of people in their pocketbooks and with businesses closing and such. What are you seeing in terms of new requests for services, and how are we as a city and a state helping with that?
Yes, and thank you for having me here today. As you can imagine, because of the coronavirus and some citizens finding themselves without employment, the number of SNAP applications has dramatically increased statewide during the last 3 weeks. Normally in Chesapeake, we receive about 130 new applications for SNAP or food stamps. In the last 2 weeks, we have seen close to just under 600 new applications. That's more than triple the number that we are used to having. So as a result, the state is relaxing some of the guidelines, some of the mandates that we have to use to process applications. They're waiving the face-to-face meetings and the phone conversations that we normally have with folks there. But certainly we have all hands on deck. We have pulled from other resources to just process these applications as quickly as possible. Additionally, the state has added an increased funding on everybody's EBT card or their SNAP card. So everybody who currently has a SNAP card for the months of March and April received additional amounts just to make sure that our families were able to buy food. The families dealing with job loss due to COVID-19 may also qualify for a temporary cash assistance through the TANF diversionary assistance with our TANF program as well. And all of these can be applied for online. That's a one-time cash assistance, but it could be very helpful for somebody who is struggling to pay their rent and so on.
Well, I know it must be stressful for you and your staff to have to do so much in such a little period of time, but knowing you and knowing your staff, it's also very gratifying to know that you're helping people with real needs.
I have an amazing staff.
Yes, you do.
They are amazing.
So, Joe, let me ask you the same question. How has CIBH adapted its programs and its rules in light of the new normal?
Well, it's been a challenge, Mr. Mayor, for sure. What we've done is we've taken about 75% of our service delivery is now delivered either by phone or by video conferencing. So we had to be on our toes to get that started. It was, in light of the new normal, it was a big time to ramp up. We had started doing conferencing with our psychiatric staff a few years ago because some of our vendors were from out of town. So it was, we had that skill set. We just had to expand pretty rapidly. And one of the biggest things we had to do, I think, was to get people acculturated to the fact that face-to-face wasn't going to be delivered right away. So the first thing we did was reach out to every person that was on our schedule and have our clerical staff contact them and say, here's the options for you. We can do it by phone, we can do it by video conferencing. If you have neither one of those, we've even set up an opportunity for people to drive up with an appointment, and we'll provide a tablet so we can do video conferencing to them to limit social contact. So that's been a big ramp up. We have a couple programs that we still do face-to-face. Our program of assertive community treatment, which is to deal with folks with chronic mental illness. We're still delivering medications on a daily basis to them. The nurses and staff there are suited up and go out every day to provide that service. And we're also continue to provide services for our day support programs and our ICF IID program, which is an intermediate care facility that we run on Rugby. So it's been interesting.
That's really fortunate, though, that you did have the teleconferencing, because certainly my experiences have had many successes with it in the last couple of weeks, but a few things that were a little testy, maybe
Right.
because of my lack of skill. But I think sometimes just the familiarity and the different types of program, especially in the medical field, I'm hearing that doctors' offices are doing obviously more of it, and that's been my experience. And sometimes they're not as used to it. And then of course you've got people out there that are trying to learn how to do it. But I think and you can attest, if we'll just hang in there, keep patient and keep trying, be diligent, that it'll eventually work out, and it may end up being a preferred way, correct?
Every day is a new adventure, and I think that's one of the things that we're experiencing. Well, why can't we do this?
Right.
And there's also some new challenges with technology that we have to overcome, but we're learning.
Of course. Good. Jill, I know the biggest division in your department is Child Protective Services. How is the virus impacting their work, and are you seeing any sort of upticks in the calls from people?
Actually, we're not seeing an uptick in the numbers of Child Protective Services referral, which concerns me. I have a lot of concerns for our children in the community. Child Protective Services has been, and we will continue to respond to all calls of abuse and neglect, but as you know, the schools are oftentimes a safe haven or a safety net for children who may be being abused or neglected at home. Also, the schools are the largest callers by far for our Child Protective Services reports. So I just would like to take this opportunity to remind the community that CPS is still taking and responding to calls. And if anyone suspects, and all you have to do is suspect, you don't have to prove it, that a child is being abused or neglected, they can simply call our hotline, and that's 382-2020, easy number to remember. And we have family service workers who will take your information and get all the details so that we can respond quickly to ensure a child's safety.
That's valuable information. Thank you for that. So while we're on this topic, you also do a lot of work related to our adult and senior population. What do you know about the seniors and their vulnerability to COVID?
So like CPS, APS investigations are continuing, but we're using judgment regarding our face-to-face contacts with our senior population. We are using video conferencing as well as just making phone calls to check up on well-being of our current customers. Many of our nursing and assisted living facilities are taking our workers' temperatures before they come into their facility. And some have even said, we don't want any new folks coming into our facility. So we've had to resort to phone calls and working with the other professionals to ask the questions. All of our social workers, when they go in the field, are wearing masks. and are keeping the safe 6 feet distance when they're interviewing and being as safe as possible. We are trying very hard to connect seniors to resources, whether that's for food, whether that's for companion services, if they need increase in medications or they're not able to get their medications, we're helping with that. And probably most importantly, we're trying to help them reach out to their family support systems as well to see how they might be helpful.
And so to your point about the facilities, the senior citizen facilities. And Dr. Wilson, I may ask you to weigh in on this because I think I've gotten a couple of calls from families who were concerned when a resident in a facility such as that is test positive for COVID-19. What's the general procedure? What are we doing about that?
Yeah, when we have a positive test, we have a routine where we respond. We investigate, we look and see if there are any other cases by symptoms on the same hallway. We also check with any of the employees, any of the staff, and right now they're not letting visitors in. And we may set specifications that only limited people come in and care for people in that particular hall if it's limited, or that they take temperatures of staff before they come. To be perfectly honest, I'm more concerned about the ones we don't know, where perhaps staff totally unwittingly are bringing in the germ. So we're trying to work right now to see how we can work with these long-term care facilities and have masks for the staff. A lot of times people think about, well, what do I do to protect if someone in the facility is sick? But I'm thinking we don't want to bring it into the facility, so we want to stop it beforehand. So we have put in an order to try and get some masks so that we can be sure that the staff at the facility are not bringing something in.
So I think the people that I talked to, in the end, that was their same conclusion, that we're glad that we know who has it, but we still worry about those that
Right.
we don't know. Good point. So, Joe, talk to us a bit about things individuals and families can do to help them cope with the new normal in a healthy manner as possible.
Well, the first thing you got to remember is to turn the mic on. The first thing you have to remember is that everybody has an emotional response to a crisis. And it's normal for people to have emotional responses. The range of them are going to change. I mean, people are going to have, depending on their life experience and their socioeconomic status and the availability of resources, they're going to react a little differently. But the range could be just about anything. I think whenever you have a natural disaster like this one is, the first thing that comes to mind is fear and anxiety. And fear and anxiety is a very common reaction. The other thing is sadness. And the reason people have those kind of reactions is because they're unsure of what's going to happen. Some of the fears may be unfounded fears, of contracting the disease, or, we've had staff even say this, people are always looking at us and saying, we may have the disorder. What can we do about that? So they're going to feel helpless, and they're going to mistake common symptoms for chronic health problems. And the chronic health problems are going to reinterpret as part of COVID-19. So all those things are sort of wrapped up. And just the stress from constantly monitoring. Coping mechanisms, there's a lot of very simple things we can do, and sometimes they're obvious, but one is stop watching TV all the time and stay off the cable news networks. I was home on one Saturday, and I got so fed up with it, I just said, my cable was out yesterday for a little bit in the town I live in. Thank God. It was a whole different thing. My wife had actually had a conversation with me. We weren't focused on the television. So that's one good thing to do. The second thing is to recognize that to cope at home, have healthy relationships. Recognize that you are upset. Recognize that there are concerns that you have to deal with, and deal with that constructively together. Make sure you take some time for yourself. When you're home with your kids all the time, if you have a spouse or a significant other, let them take care of it a little bit, and you take care of yourself. The biggest fighter of anxiety is to decrease things that are being unsure. So make yourself more sure of what you have. stick with one source, stick with your local health department for information, stick with your locality to gather information on how you cope with the disease. Do what they tell you to do, because people feel out of control, anxious when they're out of control. So get some control back. Do the things you're supposed to do. Establish a routine. If most of us around this table have had our routines disrupted a great deal, and we feel better if we have a routine, if we do the same thing at the same time. The same thing happens with kids. If you have kids, establish the routine, keep the routine up, have some fun with them. I think Nancy said this on one roundtable before. It's physical distancing, not social distancing. Make sure that you have an opportunity to link socially. If you have kids at a distance or grandchildren at a distance, do video conferencing with them, email them. Lord knows, just pick up the telephone and talk to them. And that makes a lot difference to me when my grandkids call me and my sons call me as well. So that kind of thing is a simple, easy thing to do. Some of the reactions, people start abusing more substances in times like this. So if you need to monitor yourself, ask yourself, are you acting normally for yourself? Are you eating, sleeping differently? Are you abusing substances? Are you drinking more? Those kinds of things. And if you are, seek some help, and we can provide some help with that.
A lot of great suggestions there.
Thank you.
I think the one that hits home to me is the television thing. I think my wife thinks that I don't have enough stress, so after dinner, we record the nightly news, and we go in and watch David Murr get everybody all upset. And the background music is even more upsetting than what he has to say. So I think it's prepared. It really is designed to get you right up there.
That's right.
Yeah. Thank you so much for that.
Yes, sir.
So I want to ask each of you the same question, starting with you, Jill. How can people best access the services you're providing, and has that changed from what they might otherwise be used to?
Okay, so actually there's several ways that you can access and apply for core benefits. You can not only apply for them, you can just see if you can do the same thing to just see if you're eligible for SNAP, for TANF, Medicaid, or child care. You can do that on the phone by just calling in at 1-855-635-4370, or you can go to commonhelp.virginia.gov and just apply online. That's probably the easiest way to do it. If none of those are available to you, you can always call 382-2000. That's our call center in Human Services, and we're happy to help anybody navigate through that process. We also have an updated list of open child care facilities and licensed homes that you can go to, and it's childcareaware.org. And you can get a listing of all of the child care facilities and or private day that are licensed, and be able to see who has vacancies. Some of them are really geared towards helping children of first responders, and some of them take only military families, so they really have their own niche for that. So that should be easy for you to find as well. And certainly if you have a CPS or an APS concern, again, 382-2020. I'd also like to add our regional homeless hotline for any of those families out there who find themselves at risk of becoming homeless, or who actually are homeless. And that number is 757-587-4202. And the last one I have is the food bank, and they can certainly direct you to the closest food pantry to your address, and that's 757-627-6599.
Thank you so much. And Joe,
Welcome.
what do you have?
Well, if the stress gets too much, Chesapeake Integrated Behavioral Healthcare is here to help. We offer telephone consultations, assessment, and therapy by phone and video conferencing, and if we need to, we'll supply a laptop and have you seen in the parking lot in your car if we need to maintain the social or maintain the physical distance. For help, call 547-9334. We're there 24 hours a day, 7 days a week, 365 days a year.
You both have provided so much good information, especially this last thing for people, where people can go for help, and approved daycares, and they're all, good information relieves stress. And so I just would like to, anybody who is watching this or comes across it accidentally, and you know someone who needs this kind of information, send them to the city site or the YouTube site and play what they have to say over so that you can share that with your neighbors or someone that you know may need some of this information. So thank you both for being here. You've been so very helpful. Thank you. Thank you. So let's check in with the lady who's been focusing on every aspect of public health here in Chesapeake since the crisis began. Our health director, Dr. Nancy Welch. Dr. Welch, the CDC is now recommending everyone wear a mask in public to help lessen the spread of COVID-19. I brought a couple of different masks. This one I wear to the grocery store, or if I'm worried about, I don't want to look like, a nerd, I'll put this one on because this reminds me of the days where the bank robbers would walk in the Cowboys and let's go get that bank, Johnny. So anyway, there's all different kinds of masks, and you talk to us about them.
Well, first, I'd say you're following Joe's advice. You're laughing here, and that's important. And the second thing I would say, and I've said this before, is that what happens in our community is up to us. We really are the ones who have control over it. And I can't emphasize it enough. And I'm going to get to the mask, but I want to emphasize before we even get to the mask that the hallmark of protection are the things we've mentioned: the 6-foot distancing, the washing your hands, the cleaning the environment, the staying home when you're sick. Those are the hallmarks. Nothing exempts those from being used. That's what we all need to use, and we all have the power and control to do it. So that's a very important thing. The masks have come up because the recent information from the Center for Disease Control, which is really another resource that we recommend people use, have discovered that many, if not most, people who have the COVID virus and are contagious aren't aware of it. That they may have it a couple days before they develop symptoms. They may have it and have no symptoms at any time. Or they may have such mild symptoms they think it's just an allergy or a cold, but they are still contagious. So that just means that we've had to expand our span of control, if you will, and that relates to the mask. The mask can be surgical mask or they can be cloth masks. And a number of people have made cloth masks, which are pretty creative and colorful, and we may have a new fashion trend, who knows. But the mask, I need to emphasize, prevent you from spreading the virus in the community. Just based on what I've said, many, if not most, have it. They don't know they're spreading it. The mask help prevent that from being in the community. That also helps you, not just the other people in the community, because if we have more people who use the mask, we have less virus in the community. That means there's less opportunity for you to actually catch it, because even with the cloth mask or the surgical mask, it does not prevent that virus from getting in. It's not a tight fit like the N95. That we want to reserve for the frontline responders and the healthcare persons in the hospital. But if we consciously work on having less virus in the community, then there is less opportunity for you to be exposed. As I heard some people say on a video, I protect you and you protect me. I think that's the most beautiful thing I've heard, and it's so simple and so real. The other thing that the mask does is it helps keep you from putting your hand to your face. And we've commented before that the way that the germ gets into your system is through the respiratory tract, not through your skin or even eating it. It gets in through your respiratory tract. So your face is the door. And by preventing you from touching your face and spreading the germ up closer to the respiratory tract, then we are helping to close that door. And I know here in the South we open up the door, we have Southern hospitality, but in this case it's no Southern hospitality. We are closing the door to the virus. And so the mask serves both of those purposes by reducing the amount of virus in the community and by bringing your hand to your face.
So you shared that video with me, and it was beautiful. And I thought of it the other day. Soon afterwards, I was in the grocery store, and a lady walked in. She and her husband both had masks on, and a few people peppered here and there did, but majority did not. And and the lady made a comment. She said, "I guess the people in Chesapeake just didn't get the memo, huh?" And I thought about that, and I thought, well, it's not a memo. What is it that keeps us from putting a mask on? And I think the first thing is just some sort of social consciousness. It doesn't feel right to be putting the mask on. But I think in addition to the things that you just said, the more of us that do it make it okay for others to do it. And I think that's important that we model that people see that, well, that guy's wearing a mask. I guess I probably should be too. And I think it will catch on. And I believe in that video, Czech Republic, it was talking about how great that made a difference in what has gone on in their country for doing that.
Right. It gives us a control not only for ourselves, but it also gives us a community control. And I think that's vitally important to not just think about it from our perspective, but to think about it from the community. And because what happens in the community is going to reflect on what happens to us.
Right. Thank you so much. And again, thank you for being here. You've been a trooper being here every time. Thank you so much. Appreciate all you have to share. Our city operations do continue to function, which is a great testament to our awesome staff and their commitment to public service. I want to ask, I know, Mr. Manager, you've been doing this over and over. We still get questions. I still get questions about the smallest thing. Why are you picking up that sofa, but you won't pick up the azalea bush? And I actually talked to the supervisor with that question, and he gave me a beautiful answer. I shared it with the constituent who happened to be a football coach, and I wanted to say to him, well, I guess it's kind of like why people on Saturday morning maybe ask why you made that call on Friday night. But anyway, a lot of things are happening with city services. Would you please update us?
Thank you, Mayor West, and I really have appreciated the opportunity to be here with you during these roundtables. I think they're very valuable. We've gotten great feedback from the community, and it is a great way to get questions answered quickly and to have a lot of people be able to get access to those answers. So, as I've mentioned several times before, we monitored the situation, we activated the unified command, and we're now in the middle of that respond and adapt phase. And we continue to evaluate our service delivery. Essential services remain unchanged. I sound like a broken record, but we are committed. We will. If you make a 911 call, we will respond. We're going to continue to provide you with clean, safe drinking water, continue to pick up your trash. We've had to modify service delivery in a variety of ways. So you've heard from Joe and Jill today about modified service delivery. We've talked about the libraries and some of the other programming services that we're doing in modified ways. But we want to try to keep as many services open and functioning as possible, just in a different manner to keep the employees and the community safe. You mentioned the bulk trash service, so that's one we did have to curtail. That's probably the principal update we have since the last time we had a roundtable. We had to curtail some of the bulk trash services for some operational reasons. And one of the biggies I think people will appreciate is we're trying to preserve resources to make sure that the critical core services can remain provided for. And those are, some of those resources are capital, but some are human resources. So we're really being careful with human resources. And when we have to spread out our crews, that limits our abilities to do certain things. So that physical distancing applies also to the crews that are out in the field, and we take that very seriously, but that does curtail our ability to provide some services. So just please know that we are focused on the essential services. We're focused on employee and community health and safety. We'll continue to deliver those services, continue to respond and adapt as conditions warrant. But I'm also very pleased about how many agencies are focused on what can they do outside of their business lines to help the city government, to help their other agencies, and to help the broader community. And so we have great examples of employees volunteering, so they have a little less going on in their agency because of the modified services. So they're volunteering to assist other departments where maybe services have ramped up. It's just amazing. And we have librarians and folks from other agencies making masks for health officials, making masks for their coworkers, making masks for the community. It's just super impressive, and we'll continue to do that. We'll continue to do those kind of things. But at the same time, the business of the government continues. So I still had to prepare a budget. I gave a budget work session to an empty room, but we have gotten feedback on it, gotten some questions, and we'll answer those questions. And we got to continue on with the business that's in front of us. So we'll continue to do that, continue to provide those services. And lastly, I'll say I've been very impressed. I talked to several directors today that while we're in the middle of responding and adapting, they're already focused on recovery. So how are we going to ramp up service once we're over the hump? And how are we going to make sure that we are staying engaged and moving things forward so we don't impact our long-term ability to recover? So staying safe now, doing the right thing now, not sacrificing safety now, but making sure that we're really, really well prepared to come out strong on the other side. So I'm very encouraged and remain optimistic about that. And again, I do appreciate the opportunity to have been here to do some Q&A with you.
Thank you, and thank all of our staff for the wonderful dedication, what they're doing. And all of that makes a lot of sense, and I certainly appreciate what you're doing and what our employees are doing. So to that end, I also heard, obviously we've been trying to encourage absentee voting. And so I think we have members of staff of different departments that are helping in the registrar's office to process many of those applications. This is a topic we really had not planned to get into tonight, but I did want to ask Heath Covey to just talk about some of the things that we are doing and are going to be doing to encourage absentee voting. And I also want to talk about the election in general, but obviously there's not enough time in this session, so we are going to do that this coming Thursday night and cover it a little more in depth. We're going to look at some of the legal aspects of who makes the decision of when and where and how and all that kind of thing. So stay tuned for more of that. But Heath, if you would just take a moment to explain to our citizens what we're doing and going to be doing to get the word out on absentee.
Thank you, Mr. Mayor. Yes, we are very strongly encouraging folks to vote absentee for the May 5th election. Whether the election goes forward on May 5th or becomes an all absentee, voting absentee is really right now very simple, very straightforward. COVID-19 is one of the reasons you're allowed to vote absentee, so you don't have to have another reason. You can do it simply because of the virus and your desire to stay at home. It's as simple as going to the website, cityofchesapeake.net/vote, and putting in the request for an absentee ballot. It comes to you in the mail, takes about a week, maybe a little bit less to get to you. I understand that it takes about a minute to mark the ballot, put it back in the envelope, have a witness who can be any age and does not have to be a relative or not a relative. Anyone can be your witness. Witness that you've done it, send it back, and you're all done. You voted. You don't have to worry about coming out. We're promoting absentee balloting through a great variety of manners, through our website, through our social media, through Chesapeake Television, through direct marketing on social media. We have some purchased advertising with things like Pilot Online and some of the other media to promote that absentee balloting, how to do it, how simple it is. We're going to be putting signs all through the community with the web address and the voter registrar's phone number. If you don't have access to the internet, you can call the voter registrar 277-9797, and they will take your request over the phone and send you an absentee ballot. It's very, very straightforward, very simple. We really want to get the word out to everyone how easy it is, how you can do it. If it becomes an all absentee ballot election, that's fine. If it doesn't, you've still done your civic duty and voted and had a very easy time to do that. Again, it's cityofchesapeake.net/vote or 277-9797.
Now, Heath, we talked about, and I think you mentioned before, we are reaching out to the local radio and TV stations and asking
We
for
are.
public service announcements to this effect as well, correct?
Yes, sir, we are. We're working, we have a very good working relationship with the local media, and we're asking them to help promote absentee balloting. And then, of course, if the election changes, that will ramp up because then the state will also be helping to promote that as well.
Right, good. Thank you so much. I appreciate all you're doing. Our communication department's outstanding. We appreciate you hosting this every twice a week and doing all we can to get the word out to our citizens. And I might add, if citizens have other suggestions, that's what we're here for. That's what this is for. It is time to think out of the box because we're having to do things differently, and we're all in this together. And so we welcome any comments and suggestions we might get.
Absolutely, and we are very encouraged by the input we're getting from citizens, a lot of creative ideas. We truly believe that second to the work of Dr. Welch and the healthcare industry, the healthcare business, we are very important. Information is really what's going to help get people through this, and we want to make sure we give people information that they want and that they can use.
Well said. Thank you so much.
Thank you.
So I also want to let you know that the City Council will be meeting again next Tuesday, April the 14th at 6:30, our normal time. But there will be a number of changes to that meeting process. With some members here, right here in the council, right here at the council chambers, and others will be attending virtually. They'll be calling in. The public will have an opportunity to provide input here in the chambers with some adjustments to allow for social distancing. We want to ensure that we keep the business of government moving, both to meet the current needs from the COVID-19, and so the city can remain well-positioned to return to normalcy once the crisis is over. So we will be doing that meeting, and we'll be having some discussion as to what we'll be doing the following week, if we will be meeting at all. Since it's a public hearing meeting, there may be more challenges than we can handle, and we may have to postpone that. So let me encourage you again to monitor our website at cityofchesapeake.net/COVID-19, as well as the city's social media accounts for updates and information. So until the next roundtable, continue to stay safe, wear those masks, wash your hands, and be healthy. Thank you.
With the spread of the COVID-19 virus forcing more and more people to stay home, the Virginia Department of Elections is encouraging absentee voting for the upcoming May local elections. Voting from home is quick and easy. To request an absentee ballot, visit cityofchesapeake.net/vote or call the voter registrar at 757-277-9797. You must make your request no later than April 28th so that it can be back in time for the May 5th election deadline. Everyone needs to make their voice heard in this important local election, but you need to do so safely. So vote absentee today.